thank you so much for being here. I am thrilled to have the opportunity to pick your brain because I am personally so interested in everything that has to do with hair, but also we want to bring value to our audience, the Biohacking Congress, and all the questions that I've gotten when I announced that I'll be having the chance to interview you. But before we start, I would like to know a little bit more about you. For those who still, this is the first time who are meeting you, who's Dr. Bauman, your career, and why you love to do this that you're doing right now?
So thank you so much for being here with me. It's really a pleasure to be at the Biohacking Congress. And for those who don't know me, I'm Dr. Alan Bauman. I'm the medical director of Bauman Medical Hair Transplant and Hair Loss Treatment Center located in Boca Raton, Florida. I've treated over 33,000 patients in my 25-year career and performed over 12,000 hair transplant surgeries. And so it's an exciting field. There's been so many changes over the past couple of decades. But probably the most exciting thing is that we get to change lives every single day. People who are struggling with hair loss, who want to restore the hair that they have, protect the hair that they have, and we do it at Bauman Medical every single day.
Wonderful. And I will say that it's truly having hair that you feel comfortable with can truly change your life, regardless if you're a woman or a man, because it's genderless. Hair is so important. It's embedded in our identity. And many times people is like, but why do you care so much about your hair? Yes, we do. And there's nothing wrong with that. And that's why I love the work that you do and how you can transform people's lives. But now for those who are not familiar with biohacking our hair, which is a concept that is fairly new, how do we biohack our hair, and easy steps that perhaps we can start at home before we start losing our hair?
Well, biohacking baldness, which is really the topic of the presentation that I gave this weekend, is about what are the things that we can do to identify in our lifestyle? What are the things that we can do to identify that might be putting our hair and hair follicles at risk? Knowing also what's in our DNA, what's in our genetics, right? So it's a very comprehensive, very holistic approach to the field of hair loss, which, for many years it was like medications or surgery, and that was the end of that, right? But today we know that there's so many things that can dysregulate the hair follicle function, whether it's lack of sleep or poor nutrition, a lack of nutrients and fuel, inflammation in the body, so many stress, biotoxins out there. And then, of course, what we do to our hair, sometimes we could be putting our hair in jeopardy. The styling products that we use, the way that we take care of our scalp hygiene. So biohacking is about taking control of our environment, to knowing our own biology, and taking a proactive approach to not only increasing the number of, let's say, years in our life, but the life in our years in terms of lifespan and health span. But now we're taking it one step further into hair span,
I love
which is
that.
the amount of time that you get to spend with a beautiful, thick, healthy head of hair.
And we all love that. And as a brain health professional myself, I'm all about biohacking and prevention. But sometimes we don't get to that place because we didn't know better. Maybe genetics played a part. And then when we get to that position, now we're afraid to make that and take that step of going and see a professional like you that can help us restore what was lost. And in this case, in average, do you think men or women go and see you? Who takes the first step you've seen are more proactive?
Well, early on in the practice, many years ago, we saw mostly male patients.
Okay.
But today, it's almost 50-50.
Okay.
And the reason is because, first of all, 50% of men by the time they hit age 50 are going to have some severe hair loss. It's noticeable to the naked eye, but also women as well by the time they hit that age. About half of women are going to have some hair thinning. They might notice a different type of hair loss. They might notice that their ponytail volume is decreasing, or that their hair quality or texture is changing, as opposed to male pattern hair loss, which is maybe more of a receding hairline or thinning in the crown area. So male and female pattern or androgenetic alopecia looks different in men and women. But I think today we're seeing people come in at an earlier stage than ever before. And so sometimes I think, there's just more dysregulation of the hair follicle function, that we're seeing more hair loss because of all these things that are happening to us in our environment and our stress level in the modern age, nutrients and fuel and everything we've talked about. But also, I think that today there's more things than ever we can do to help protect our hair follicle function at that early stage. And so people are just more aware that, hey, we can do something. You don't have to just deal with it.
Yeah.
You know,
Like what? Can you give us, I mean, besides obviously go and see you, I would say, first of all, what can we expect when I go and see you? And which steps should I take after I go and see you?
So when someone comes into the office for an evaluation, the first thing we want to do, everybody always asks, well, what tests are you going to run? Well, hold on a second. Before we get to the testing, let's have a little bit of a talk here about your hair loss history. How has this progressed? What's happening now compared to what was happening before? What's the hair loss in your family? What are the hereditary factors that we can identify through your biologic relatives? And then let's get into those lifestyle factors. Your nutrition, your sleep, your stress management skills. Those things are so important. Do you have other medical conditions, underlying autoimmune or toxicities or things like that that need to be addressed? So I would say the first step, just pretend that you're me and look at some of those things. Try to evaluate in your life what's going on. You're going to be much more better prepared when you come into the office for when we have our little discussion. Now, of course, if we know that there's underlying medical conditions, or let's say a woman comes in around the time of menopause, perimenopause, or menopause, we know hormones are fluctuating. We might want to recommend then a more in-depth look at biomarkers. Let's take a look at, are you anemic? What's your thyroid levels? What's going on? I mean, what's happening with these hormone levels? So we take a very deep look. In fact, I have an entire department now dedicated to functional medicine inside Bauman Medical. So if we uncover something during that consultation process, we can immediately activate what we call Bauman Performance and get you a consultation there and dig into those biomarkers. We can do DNA testing to see if there are metabolic pathways that might influence hair follicle growth or hair loss. And that will tell us, in a very personalized precision medicine approach, what therapies and treatments we might want to implement to start right away.
Wonderful.
But for people at home, I think they've got to look at their overall, what we say, allostatic load. Like, what is the overall stress level? What are these things that are, causing more stress on the body and lack of sleep and such that really can impair hair follicle function? There's a lot. And look at nutrition. We have some great nutritionals that are available. You can start on those before you come in the office. You can look at hair care products to make sure that your scalp health is on point. But if you're not sure, then we need to dig deeper.
Yeah. So if I hear you correctly, you love to go deep and find out the root cause, not just come to me and let's get you with a treatment, but never looking into the root cause that might be causing, the hair loss or baldness.
Absolutely. I mean, look, if a young man comes in and he's have a receding hairline or thinning in the crown, we know there's a genetic tendency. It's obvious male pattern hair loss. But let's talk about it. Is he an athlete? Is he, increasing testosterone through the use of, let's say, supplementation? And there's lots of supplements now that are touted to increase testosterone, as well as DHT, dihydrotestosterone. Like, for example, creatine. It's great for performance in the gym, but it might be affecting your hair. So we take a very strong look at that. And so those are lifestyle factors that we take into consideration before we just run and jump into the traditional medical approaches or medications and other things.
That is, it's so interesting. I mean, we could spend hours here talking about that. And my main thing that I am interested, and I know that people watching this want to know, once we take that step, now I'm having the procedure. Does it hurt? What is the recovery process? How does that look like? Especially in my case, if it is a woman, I might think it's different, the recovery process from a man. What does that look like?
Yeah, so in between some of the non-invasive therapies, some which we've talked about, like nutrition and hair care, we can even use laser light therapy or injectable treatments like PRP, platelet-rich plasma, and new treatments like TED, transepidermal delivery. But if the follicle is dead and gone, what you're asking about is hair transplantation.
Yes.
And of course, we do a lot of that because by the time patients come in, sometimes it's too late to rejuvenate those follicles. So hair transplantation today, very different than the years before. It's a painless process. It's done under local anesthetic in a very sophisticated way to keep the patient comfortable. So that all you feel is a little bit of tapping. You're not going to feel any pain or pinching during the process whatsoever. Local anesthetic keeps the entire scalp numb.
Okay.
So people who are afraid of the procedure from years and years ago because of the discomfort during the process, no. This is not like getting a big tattoo for 6 hours. No.
Okay, good to know.
This is a comfortable process. You're going to watch some movies. We're going to cater you some lunch. You'll be relaxed and reclined during most of the procedure. Other times you'll be maybe on your side or on your belly while we're doing the work.
Okay.
Yeah, but it's a comfortable process. By the end of the day, you might be singing karaoke with the team, listening to music and such.
Listen, I'm all for it. And then I had the procedure. How long should I expect in the process of the recovery to say, hey, look, my hair is back?
Right. So, well, first you got to get you through the healing phase first. And so a lot of patients are worried, oh my God, what's my downtime going to be? How long are people going to notice that I've had a procedure? So there's the cosmetic aspect. Wherever we've done the work, whether it's your eyebrow for an eyebrow transplant or your hairline or someplace further back, you're going to have some crusting and some scabbing in that area.
Okay.
Depending on the size of the session, if it's for women, the area that we harvest from is completely hidden underneath the existing hair.
Okay.
Sometimes we harvest the follicles without even trimming any hair, not even one strand of hair, for
wow.
example. So that area is completely covered. That's called the donor zone.
Okay.
The recipient zone, crusty, scabby, maybe a little bit swollen. So swelling lasts maybe a day or two, and then it resolves.
Okay.
The crusting, that's going to flake off in about 6 days. 6 to 8 days is
Fast.
basically your cosmetic downtime.
Okay.
If you are a news anchor or in the entertainment world or you're in front of people, we tell you 2 weeks, just to be safe.
To be safe, yes.
But most people are completely healed in about a week, so like 6 to 8 days.
Wonderful.
Yeah, so it's a minimally invasive process. And remember, the way that we're doing hair transplants today, no linear scar left behind, no stitches or
wonderful.
staples. We're taking the individual grafts one at a time using an FUE approach, follicular unit extraction.
And that is wonderful to know, because I know a lot of people are afraid of how it's gonna look like after. Am I gonna have any scars? Or people want to notice that and then my brother-in-law, like 50 years ago, had one, and still I can see the line. But you've mentioned things have improved so much, so it's almost like you cannot see the donor area.
Correct.
Especially for women.
Correct. So the way that we harvest hair today with the modern techniques, minimally invasively, does not leave you with any linear scar whatsoever. There's no scar to hide. We
I
take
love
the
it.
individual follicles one at a time.
Okay.
Yeah, and then but it does take some time for the hairs to grow. 5 months, hairs are going to start to become visible. 6 months, you'll have half of the result.
Okay.
Meaning most of the hairs are growing, but not very long or thick yet. And then it takes a good 1 year, let's say, to 12 to 14 months to see the final result from the transplant.
Yeah, because I think it's so important to be also realistic and that people understand, hey, you're not going to have your full mane,
Well, you don't wake up with hair.
Exactly, you don't wake up with hair. Please know this. But you mentioned something very important, especially for the millennial generation, which I am part of. We overplucked our eyebrows when we were in high school. It was all the rage, and now we regret it. So for those who are not lucky enough that Mother Nature gave their eyebrows back, how does that look like, having an eyebrow transplant? Because we didn't have that before, and now it's all the rage, especially in Hollywood. And how does that look like? Walk me through that process of doing a eyebrow transplant.
Yeah. So somehow we got from these wafy thin eyebrows of the 1980s and early 90s into the Kardashian era, where the brows are much thicker and so forth. And I still think we're in the tail end of that trend. So as you had mentioned, many women have overplucked, but also there's medical conditions and hormone imbalance, thyroid and things like that can knock out your hair in your eyebrow area. So eyebrow transplantation takes the hair from the sides and the back of the scalp and implants them very carefully into an eyebrow design that you and I would agree on, and with the appropriate angle, orientation, position, and curl.
Okay.
Each follicle has to be appropriately implanted in order for the eyebrow to look good when it's all said and done. But it's going to take about a week or so, like I said before, to heal, and then the hair that's been transplanted sheds and regrows months later.
Okay. So we're taking hair from our actual head and then putting them in the eyebrow area.
Correct. So hair that we see is a hair fiber. That's a dead piece of keratin, essentially, just like your fingernail. But underneath the scalp is the hair follicle. The follicle is a mini organ that contains 100,000 cells that makes the hair.
Okay.
Think of it like a 3D printer. And we take that little 3D printer from the back of the scalp and we put it into the eyebrow area. And each eyebrow could contain anywhere from 200 to 500 grafts. And that's all completed, again, under local anesthetic. And
Fascinating.
now remember, the follicles from the back of the scalp or the sides of the scalp, they grow a little bit faster than your normal eyebrow hair.
Okay.
And they also grow longer. So that means that eyebrow transplantation comes with scissors, very much like eyelash transplantation also. So you do have to trim and groom the brows and or lashes if you decide to do those on a regular basis, usually at least once or twice a month.
Look, if it helps with, undoing that overplucking situation, I know many of us will agree, I'll do it.
If you're painting on your eyebrows or you're thinking about having a tattoo there, obviously those are very two-dimensional and temporary thing. The eyebrow transplantation is a permanent three-dimensional restoration of the eyebrow area.
Yeah.
It's a very rewarding procedure to do.
Yeah, I can imagine. Going back to some biohacking practices, I know I've seen red light therapy. It's all the rage. And what's your take? Is it real? Is it a gimmick? Does it really work when it comes to helping hair regrowth? What is your take?
So if you rewind to 1999 when I learned about laser light therapy for hair regrowth, it was a device that came from Sweden. It was a huge device that looked like a hair dryer. It sat down over the scalp. And they were telling me they're using it in Europe to regrow hair. I didn't believe it. But I was able to work out a test drive for that device in the practice, and I was really surprised as we put more and more and more patients under that device how their hair was responding.
Okay.
So if the follicle is dead and gone or beyond repair, all of these treatments that are non-invasive have very limited chance of working to get you to your goal. But if the follicle is weak, it's producing a thin, wispy or shorter hair, red light therapy, and especially more importantly, laser light therapy is the key. So did they teach us about that in medical school? No. They did not tell me that red light affects the mitochondria, is accepted at the photoacceptor molecule, the cytochrome C oxidase, and turns into ATP, which is the energy that the cells use, that it increases blood circulation, can decrease inflammation. No, they didn't teach us any of that. But in the time since, I've learned from my mentors who are some of the most prolifically published scientific researchers on low-level laser light therapy and photobiomodulation, which is what we're calling it today. So red light or laser light therapy does work to improve your healing from a hair transplant and your hair growth over the long run. And in fact, a strong portable home device like a turbo laser cap, for example, which is best in class, is your least costly hair restoration treatment over time.
There you go.
It's a great investment. It's a one-time purchase. You have it forever on hand. The turbo laser has a lifetime warranty, so the company that manufactures it will always stand behind it. And right now it has 25% more coverage than any other device on the market. More power, more lasers, complete portability. That's the go-to device if you're going to treat yourself at home, which is great for biohackers.
Yeah, and that was my question, because there's so many devices out there right now, and it's so confusing. And we just want to know, is this investment worth it, or do I just go straight and get that transplant? But you mentioned something very important. If the hair is already gone or mostly gone, that might not be the approach. This is mostly for people who are still, the hair is still there. It's like a little boost, right? And then, but it works, because I was a little bit, I have to confess, I was a little bit concerned. Is this true? Is this a gimmick? Because those devices are an investment, right?
Sure.
And we want to make sure that if I invest in this, I am going to see the return of that investment, which is, my hair.
Well, I mean, you have to think about these devices. They range in price and manufacturing quality.
Yes.
Some of them are cheap knockoffs from China. They look like bike helmets and so forth. You've got to focus on a decent quality device. And just like if you're going to buy a TV or a piece of stereo equipment or a speaker or something, you get what you pay for in electronics. And nothing is more true than in the world of low-level laser light for hair regrowth. And as soon as you start searching on Instagram or whatever, you're going to be bombarded with 20 different ads of all different devices in the consumer market, which are underpowered, weak, cheap pieces of plastic, and not going to get you the result. So that's why you should go to a physician, a practitioner who has vetted and tested and tried these treatments, and also can measure your results. And so that's what we do in the practice. Now, the non-invasive therapies, of course, do not do the same thing as a hair transplant. They cannot.
Yeah.
But they have to be used together. Because the transplanted hair is permanent. So if you have to restore your hairline, for example, you need a transplant for that.
Yeah.
But you still need to protect the other hair so that you can preserve it for the longevity.
And the new one that is coming out after the transplant, you need to, I guess, to keep up with it, especially after all the investment, not only in financials, but the time, and then you want to make sure that everything looks good.
Well, as I said, the transplanted hairs come from the sides and the back of the scalp, which is the more permanent zones. When we transplant those hairs into the thinning or the balding areas, they're very resistant to the ongoing process. Now, of course, if you have something that's affecting your whole body, you still need to take care of yourself holistically.
Yes.
But for male and female pattern hair loss patients, which is mostly what we see,
Yeah.
the transplants are permanent. It's your other hair that we're worried about. So that's what is, we are very keen on helping you protect. Now, whether it's homework assignments like a topical medication or oral medication, or your nutritional supplements or laser light, or things in the office like cell therapy, PRP, platelet-rich plasma, exosome treatments, PDO, polydioxanone, these are all different types of things, TED, transepidermal delivery. Those are things that are designed to help protect the non-transplanted hairs, as well as, also to heal you faster from the surgery.
Yeah, absolutely. One of the things that I love about your work is how that you see everything from a holistic perspective, and you take in consideration not only the hair, but also the nutrition, lifestyle aspects that might be affecting. And we're seeing more and more now all these radical processes that we go through in the name of biohacking that might not be good for everybody, especially, for example, women when it comes to intermittent fasting or rapid weight loss processes that really take a toll on our health, and by that also affects our hair. What's your take on that, and do you agree with intermittent fasting?
Well, I'm an intermittent faster, and my health journey didn't start that way. I kind of replaced my large, major protein shake, which was also filled with carbohydrates in the morning, with bulletproof coffee a number of years ago, and then went to my 18-6 5-day-a-week fasting program. But not all men or women can do that kind of intermittent fast.
Correct.
So if you are experiencing rapid weight loss, whether it's from intermittent fasting or even a weight loss medication like the peptides we see, semaglutide and the GLP-1 agonists and such, or if you've had bariatric surgery, and you're losing weight, or you even just are on a strict caloric restrictive diet, you're going to lose hair. Because the body is smart. It will shift the nutrition to the core organs, if you will, and it will neglect those luxury organs like our skin and our hair. So we do see a lot of hair loss associated with all of those things, rapid weight loss especially, for sure. So once you rectify the nutritional balance, then the hair will typically regrow and do well, but sometimes there's too much of an insult and it doesn't rebound.
Yes. And then it doesn't rebound, and is there anything we can do about it?
Well, of course, there's a lot we can do. I mean, obviously, rectifying the nutritional imbalance is the first step for sure, once you've reached your weight loss gain or weight loss goal, let's say. The other therapies and treatments we spoke about, laser light therapy, nutritional supplementation, like in terms of protein, vitamins and minerals and probiotics and things like that to normalize everything, and whole body inflammation as well. And then to stimulate the follicles using either chemicals or other treatments like the peptides and growth factors in the office.
Wonderful. And to close out our conversation, again, we could be here. I'm so interested in hair, and it's such an impactful part of our lives. I will say that personally about me. I think I grew up being Latina. I grew up in a household where hair is such a part of our identities, and it can affect so much, even our emotional parts. Do we have it? Do we lose it? What's the state of it? And even me growing up in a household from Hispanic background, I know it's very similar regardless of our background, heritage, or demographics. I think it's so important. So the work that you do, I don't have to tell you, this is so extremely important. I am so grateful that you took the time to be here with me today in the Biohacking Congress. I have one last personal question. I know your practice is in Boca Raton, and of course you're here in Florida, but since you're here in Miami, what's your favorite Latino dish that you have to try when you're in Miami, or do you want to try if you haven't?
Yeah, well, I'm a coffee drinker, so Cuban coffee for sure is
Yes.
like a must. I have to have that, but pastel de guava is really my weakness, and so guava pastries for sure. I ordered them for the team. Not really appropriate for biohacking, but they did work hard to set up the booth, so we did celebrate with some empanadas and some,
A little balance, right?
Yeah, so we have a little bit of a treat there,
Yes.
you know.
Well, thank you so much. I mean, I hope that this was informative. And if you have any questions after you catch this, of course, you can reach out directly to your social media. Can you share, please?
Yes, so you can find me on all social media at Dr. Alan Bauman. But if you are out there and you see yourself with thinning hair, your hairline is changing, maybe your ponytail volume is shrinking, or you're seeing more scalp shining through, the journey to hair restoration can start from anywhere in the world, right at BaumanMedical.com. That's the website where you'll find thousands of pages of information, hundreds of hours of videos about all the different types of therapies that we talked about today and many others, and the evaluation process, which, again, you can get started virtually from your home or phone. You can also, if you're afraid, just click Ask a Question, and I'll get right back to you with the answer to your question. If you would like to start a consultation in your hair restoration journey from anywhere in the world, BaumanMedical.com would be the place.
Thank you for sharing that with us. And my name is Candy Calderon, Candy Calderon _ on social media. I'm the founder of CEO Wellness Club, and I hope to see you guys soon.